So we've looked at his head, we've looked at his neck. The next thing I'm going to do is listen to his heart and lungs. If you use a stethoscope, some common things that I'll see is everybody wants to put them with the earbuds facing back. And that's how, if you see a doctor on TV, they'll do that. They actually need to face forward. So if you're shadowing us in the clinic and I have you listen, just throw those earbuds face forward. And so the heart kind of sits right here, actually tucked underneath the elbow, kind of up in the armpit. If you listen right here, the sternum, the breastbone is in the way, and so you're not going to be able to have a good listen. So I'm going to listen to both sides. And then I'm looking at the clock, and I'm also getting his heart rate, which is how many beats per minute. Okay, good. Listen to his lungs. Heart and lungs sounds great. Yes, so he sounds really good. Next thing we're going to do is we're going to stand him up, and I'm going to have a good feel of his abdomen. And so things I'm feeling in front of his abdomen is I'm feeling for any signs of pain, any signs that he is bloated, any signs that he is tense. The liver and the spleen sit kind of up here, tucked right underneath the rib cage. If they're big or we have a growth off of either one of those, oftentimes I can feel that just on palpation and be able to make that diagnosis. Feeling to make sure his intestines aren't big and full of air, that we don't have any constipation. Again, he feels great. Something else I'm evaluating is the body condition score on a dog. There's a couple different scales you can use. I use a scale of 1 to 9. And I would say Ernie, he's at about a 5 to 6, which is ideal. 4 to 5 is actually probably perfectly ideal. I'd say Ernie has maybe a little more flesh on him than he should. But what I'm looking at is kind of coming along his back, making sure I don't see the tops of his spine, but I can feel it. Same thing with the ribs. I don't mind to see a little shadow of the ribs, but I definitely want to be able to feel them with a flat hand when I come across his chest. And he looks good. And then kind of coming around, my next thing is I'm going to evaluate all of our legs. So I'm going to put all of his joints through this range of motion. You see how Robbie adjusted and she's holding him up underneath his barrel now. Going to kind of check this front leg too. I'm going to look at his nails, make sure they're not overgrown, look at the bottom of his paw pads. And then the last thing I'm going to feel is the lymph nodes back here and his pulse. I can actually feel his pulse up underneath these back legs and make sure that feels good. Okay?